The efforts that are being put in diabetes by Merck, it's a recognition that there is a lot of work to be done in diabetes. It is knowing that a lot of people who have diabetes are not diagnosed. And when you talk about 4.5% for Kenya from the Ministry of Health in Kenya, you know that this is a big step. 300,000 Merck Diabetes Days. And knowing that in the last 3 years we have living health and diabetes. And Merck is at the forefront for this. It is profound. The role of DMI in either the prevention or reducing the numbers that are getting diabetes and non-communicable diseases is to raise awareness on prevention. And if for any reason after spreading the message of prevention, there will be somebody who still get, and they do, who still get the condition, or they already have the condition by the time we get to them, then we'll talk about good management practices so that they do not get into complications. So we talk about the primary prevention and the secondary prevention.
In Kenya, non-communicable and chronic diseases already account for over a quarter of all premature deaths. Diabetes is a good case in point. It's one of the most common NCDs. And according to some estimates, there are 400 million people with diabetes around the world. 77 of them live in low and middle income countries. And the rates are growing. In fact, it looks like diabetes will become the 7th most common cause of death worldwide by 2030.
We have come into partnerships with various corporates, and Merck is one of them. And we've been in a good partnership now for the last 3 years, and it culminated this year in the diabetes, Merck Diabetes Days. And we started testing people in the last 4 months now, with the initiative that Merck has put together. This partnership, we're going to continue screening people, and we hope that in the next 3 months we'll have about 2,000 people in Kenya only.
This is about bringing experts together and creating a movement so that we can combat these problems and that we can enable Africans to solve the problems. That is why we put together this luminary program, which focuses very much on non-communicable diseases, on how to prevent, diagnose and treat diabetes.
I want to urge all of us present here today to assume responsibility for our own health, as halting the burden of NCDs like diabetes begins with the individual and the choices we make.
This conference has included professionals from all parts of Africa to come and talk to us and give us best practices. That's why we have all these speakers from various parts of the world who will now introduce simple, practical processes, methods that work even in their practical, simple methods that can be used in the reduction and in prevention of NCDs.